Hello again, everybody. Welcome back. It's Dr. Ted again, and it's still March the 10th. I'm just going to answer some questions. These are very good questions. This is from one of our viewers named Brianne. I don't want to use anybody's full name because I don't want to embarrass anybody, but hi, Brianne. Shout out to you. These are very good questions. I thought this is good because I don't know what people don't know. So if you have questions, just email me, Dr. D-O-C-T-O-R, ask Dr. Ted, spell out the word doctor, ask Dr. Ted at gmail.com, and we'll answer these. Now, listen to these. These are very good questions. One, we did one on asthma, and she asks, when do you use a nebulizer versus an inhaler? They're both albuterol, right? Is there an advantage of one over the other? That is a fantastic question. So just to go over this again, let me grab my little pointer here. So here's asthma. Here's asthma in a nutshell. Okay, so we have our windpipe. That divides into two bronchi, right and left, right bronchi, left bronchi into our lungs. And then those divide into smaller bronchi and smaller and smaller and smaller until you get to the very end where you get the little air sacs and oxygen exchanges with carbon dioxide. Now we're going to take one of those bronchi and cut it and look down the gun barrel. And here's what we see. If I can hold this where you can see. Here's a normal one. Nice thin wall, lots of room for the air to move in and out when you breathe. Here's one with asthma. Now, asthma and bronchitis, inflammation of the bronchi, are very similar. Can you see this? It looks like licorice wrapped around the outside of these tubes. These are smooth muscles, involuntary. They're very small. They've blown this way up. These are involuntary muscles. We can't control them. They have a mind of their own. When you get an asthma attack, those muscles constrict. And can you see it looks like it's just squeezing that bronchi right there, right? Here's relaxed. Here's what I'm doing right now. Here's what somebody with asthma says. And they'll say, I feel tight. My chest feels tight. And can you imagine if you multiply this by 10,000 little tubes on each side? Yeah, you'd feel tight. That would feel tight. So what we give to get those muscles to relax, to go from this back to this, get those muscles relax, and the person can breathe again. What we give is there's two different things. One is this. That's an inhaler. That's the kind you hold in your hand and you always shake it up really well because the particles separate a little bit. You put it in your mouth and then you squeeze it as you're breathing in. And then you hold your breath for 5 seconds. 1, 2, 3, 4, 5, to let that mist settle in. Because if you squeeze this and you breathe it in, and breathe right out, you'll see this little cloud come out. Well, that's all your albuterol. That's all your medicine. That's the medicine that you want to use to get those muscles that are squeezing and tight to relax. You don't want it outside of you. You want it in these tubes. So you hold your breath. Suck it in, hold your breath for 5 seconds, then you can breathe out and it'll settle into these little tubes. It'll settle against the walls and it'll work. And it works quick. I mean, within a minute or two, they'll go from these muscles squeezing and tight chest and hard to breathe to these relaxed muscles. And the kid will go, very good. That's what you do at home. If you get asthma, more severe case of asthma, and the little inhaler, it feels like you're using it all the time, sometimes your doctor will say, you know what? Let's give you a nebulizer machine, and you put there's a little squirt bottle, and you squirt the albuterol in this little machine, and then you turn this on, and it makes this little liquid go into a mist, and you put this part on your mouth, and you breathe this part out, and it looks like they're breathing the peace pipe, right? And so what happens is, they look like this. Let me show you. I got a couple of pictures of some kids doing it. Here's a little girl. She's breathing this. You turn the machine on, it nebulizes it. It makes it into a mist. And you're right, it is albuterol. Albuterol, sometimes they can put another medication in, which is beyond what we're talking about here today, but it makes those tubes from squeezing relax. And so first thing we do when a kid comes to the ER and they're just tight and they're coughing and they can't breathe and they're just working hard to breathe, their nose is flaring and their lungs, their chest skin is kind of sucking in, we call those retractions, is we do this. We say, get a nebulizer treatment going. The difference between nebulizer is you get this much albuterol continuously versus a little inhaler where you may get this much each time. If you're home, you can do that inhaler, shake it up and do it Hold your breath for 5 seconds. Then do it a second time. Shake it up again. Do it again. Hold your breath for 5 seconds. Then give it about 10, 15 minutes. If it's not working, you can do it again. And you can do it again and again and again. You can do it several times, 6, 7 times. 6 or 7 of those little handheld inhalers, like 6 or 7 of doses of that, and hold your breath each one so the medicine stays in your lungs. 6 or 7 squeezes like that is the same as doing that. But this is a lot easier, and if you have to do it a whole bunch of times over and over, kids get asthma in the winter, it gets worse. It might be smart to have one of these just at home, and they can set it up themselves, and kids get really good at this. And they look really scared, and then when they start looking like this, everybody starts feeling calm. The nurses are calm, I'm calm, everybody's calm, the parents are calm. We love it. When the kid looks relaxed, that means that the lungs, they've relaxed and the kid can breathe again. And then, like you were saying, they do have 2 kinds of inhalers. This is an albuterol inhaler, like I wrote right here, albuterol inhaler. That's to get those tubes to relax. Well, the other one is, can you see again? Remember how the walls can get thick and inflamed compared to the normal thin wall? You can get real thick, irritated, and mucus. And look how hard it is to breathe through that little hole, especially with mucus in there, compared to a nice, normal, big opening with no mucus. That one you need steroids or prednisone, and they make inhalers just with prednisone in them. This is just one brand. I don't have any ties to Advair. First thing I pulled up on the internet. This is a steroid inhaler. So just like they have albuterol inhalers to get the tube to relax, they have steroid inhalers to make that thick wall become thin again and get rid of all that mucus. So sometimes you use that one first till they feel better. Then you follow it with that one. You use an albuterol inhaler, and then you use a steroid inhaler. Kids that get it all the time, every day, maybe they get it January every day, February every day, March every day. You may just have them use this every day, even when they're feeling fine, and it keeps them from going from this to this. If they use the steroid inhaler every day, we can prevent this from going to this. So that's a very good question, right? Nebulizer machines give you a bigger dose than the inhaler, but if you use the inhaler a whole bunch of times, have them hold their breath, because a lot of times they'll take it in, breathe it right back out, and it feels like it's not working. They just didn't let the medicine sit in there for 5 seconds to do its job. And it'll work just as good as a nebulizer, but if you get it all the time, nebulizer is getting a way bigger dose with one piece pipe you're breathing the mist versus the inhaler, okay? But you can use the inhaler more than once. Okay, that's a very good question. Here's another one. Sports type of injuries, sprained ankle, sprained wrist, etc. Any good signs that you should be taking your kid to urgent care, right? My oldest is playing soccer a ton and will roll her ankle in a game. If she's a good player, she'll roll her ankle. She'll get bruises and bumps and roll her ankle. If you're not that good, like when I played football, I never got hurt. I was on the bench. I got my uniform got wet a lot, passing water out, right? Roller ankle in a game, and I never know how long to wait until we should go to the urgent care. If I should use RICE. RICE is R-I-C-E. Rest, ice, compression, elevation. What the checklist is that warrants an emergency. That's a fantastic question. I love this. We avoid the ER urgent care at all costs, but sometimes I stress I'm overlooking things. Welcome to parenthood, right? One big guilt trip. The minute you find out, oh my gosh, we're going to have a baby, till that either you or that kid dies, it is one big guilt trip. You never know you're doing the right things, or you're doing enough of the things, or maybe you're doing too much and you shouldn't be doing certain things. It's all guilt. If you're a parent and you don't have guilt, you're not doing it right, right? So this is a great question. I saw these every time I work. I see these, right? We all know what sprained ankles are and sprained wrists and all that kind of stuff. First of all, let's talk about what ligaments are. If you have a bone and another bone and they're meeting each other, that's called a joint. Wherever 2 bones meet, that's a joint. So think of your hands. You have a whole bunch of joints. There's a joint there, there's a joint there, and a joint there where the bones meet, right? And bones are tied together by ligaments. Muscles are tied to bones by tendons. When you tear a ligament, just like you tear a piece of paper, you can tear a ligament. When you tear a ligament, whether it's in your finger, your wrist, your ankle, when you tear a ligament, there's blood vessels that go through that ligament. When you tear the ligament, those blood vessels tear. And what happens? Torn blood vessels, they bleed, they leak, and they get into the tissues, and sometimes they'll get to the surface. That's what causes bruising. It's blood that used to be in the blood vessels, but now that the ligament is torn, it's out of the blood vessels, and now you can see a big bruise on the skin, right? And so here's just a picture of a hand. Look how many bones are in the hand, right? There's a ton of bones, and ligaments tie bones to bones. So in the hand, there must be tons of ligaments. This is just the wrist. Here's one arm bone and here's another arm bone. Look at all these ligaments. There's dozens of ligaments that tie bones to each other. This bone to this bone, this bone to this bone. When you tear a ligament, you know what happens. Here's one, here's an ankle. And look at all the ligaments in your ankle. There's dozens of ligaments in your ankles and dozens of ligaments in your hand and in your wrist, your knee, your elbow, your shoulder. Anytime a bone is held to another bone by a ligament, that can tear. And here's what happens, right? You roll your ankle. We've all done this. And look at that ligament. It rips. And look, all the blood vessels that go through that ligament, there's another one, they tear. And it swells. So what we want is we don't want all that blood to come out of that ligament. The more blood that comes out, the bigger the ankle gets, the bigger your wrist gets. So we want to counter that. There's two ways to do it. One is with ice. Ice sucks. It's cold. It's painful. The kids don't like it. It works. It makes the blood vessels squeeze. Cold makes blood vessels squeeze so they don't bleed as much. Not a bad idea if you're an athlete. You don't want it to bleed. You want to put some ice on it. If you watch Monday Night Football in the NBA, anytime somebody jams a finger or tears a finger, in other words, the ligament rips and their finger dislocates, they pop it back in, they put ice on it, and then they wrap it. And you wrap it with this kind of stuff, right? This is Coban, it's called, and this is that kind of stuff. There's different colors. This would be one you use for your finger. Something bigger like this would be something you use on an ankle, right? And so this one is cool. You can buy this at any store, Walgreens, Walmart, Target. This stuff sticks to itself. So you wrap the joint where it's sore. Don't wrap it too tight, but wrap it enough, and it sticks to itself. You can tear that off and it'll stay right there. It's awesome. Then you have these other ones, ace bandages. They've got these little clips that you can have. The fancier ones have Velcro, though. You don't even need these. These things, you can poke your finger. I've done this many times, like those sharp little teeth. Looks like a snake, right? Those hurt. They have them now with Velcro, and you wrap that around your wrist or your ankle, right? If you sprain your wrist. Oh, by the way, there's another thing. A ligament, when you tear a ligament, that's a sprain with a P. You sprain your ankle, you sprain your knee, you sprain your finger or your wrist. When you tear a muscle or a tendon to a muscle, it's with a T, strain. You strain your back muscles, you strain your hamstrings, right? Muscles are strained, sprain with a P is ligaments. And what you do, you can just put pressure on it like this. You can wrap it with pressure, and that pressure takes those blood vessels that are torn and it clamps down on them and it keeps the swelling down. The less swelling, the less bleeding you have after a torn ligament, the faster it will heal. You want that blood to be as little as it can, because your body, with all that extra blood outside the sprain in your wrist or the sprain in your finger or the sprain in your ankle, all that blood has to be absorbed by your body. And it does great, it'll do it. But if you have this much blood, it will take this long to heal. If you have this much blood, because you got pressure right on it, it will take this long to heal. If you got a ton of blood, it will take weeks to heal, because your body has to mop all that blood up, and it takes time to absorb all that. So you can put ice on it, and I've even seen on Monday Night Football, some guy will sprain his knee, right? The ligaments, he'll sprain his knee ligaments. They'll put a bag of ice and then wrap around the ice so it has cold and pressure, and that guy's playing in a week. That's how they keep them from, they want as little swelling, as little blood in that tear as they can possibly get. So the bottom line is this. Anytime it's really tough to break a wrist or an ankle, if you are running full speed and you twist it and it's really swollen, I've been fooled. I would think it's not broken, or it's not, or it's just a sprain, and that's a break. If it's really swollen and really black and blue real quick, it probably tore the ligament, certainly, and maybe broke the bone, and the only way to know is to get an x-ray. However, if it's just a little swollen and it's just a little bit tender and they can kind of bear weight on it and they can kind of use their wrist, go ahead and wrap it with this. Put this or that Coban wrap on it, right? This, and give it a couple of days. Give them some Advil. 2 Advil 3 times a day, and give it 3 or 4 or 5 days. If it's feeling better, it isn't broken. If the bone is broken, likely it's going to be broken like this, just kind of cracked. That's not going to hurt. If they go like this for weeks, it's not going to hurt. It'll hurt. They'll go, "Out, my arm's really hurting, my ankle's hurting." It's not going to hurt. If it's broken to the point like this, like a car accident or you fell off the roof and the bone is really broken, you won't need anybody to tell you that. You can see it. You'll obviously need to go to the ER for that, or the urgent care. But if you're not sure, it's just they rolled their ankle and it's a little sore, wrap it, ibuprofen, give it 4, 5, 6 days. If they can move it and walk on it and do fine, it's not broken. And I see, for every broken ankle I see 50 that are sprained. They're really hard to break, an ankle or a wrist. Falling on an outstretched hand, that can do it. But ankles are tough. When I see broken ankles, it's usually a motorcycle, or they fell off of something, or they were snowmobiling, or some major force. But guess what? First thing we do is we x-ray everybody, because you can't guess, you don't know till you see an x-ray. So, but if it's not that big, not that bad, it's not immediately swollen, it's not immediately huge and swollen, wrap it, put some pressure on it. Ice if you want to. I don't think anybody likes ice. It's miserable. They hate it. You got to put it on, take it off in 10 minutes so they don't get frostbite. But pressure, you just put it on. You don't need to wrap it tight at all. Just enough that it's snug and you can feel there's a little pressure. And then just leave it. And you'd be surprised in 3 or 4 days with some ibuprofen, they're feeling great. And you're like, "Oh, so glad we didn't go to the urgent care or the ER and get this huge charge for a simple sprain," right? So horrible, bruised, big, quickly, go in. If it's not that bad, they can kind of move it. They can kind of put weight on it, wrap it, put pressure on it, give it some time and some Advil, a couple days, 3 or 4 days. You just saved yourself a ton of time and a ton of money, because they're not cheap, right? They charge you $1,000 just to say hello in the ER. "Now, why are you here?" And then the bill goes up from there. If you get an x-ray, "Oh, that's going to cost you." So hopefully that'll save you some time and some money. Fantastic questions, Brianne. Well done. And hopefully that helps others. Anybody who has athletes in the family, you're going to see sprains and you're going to see strained muscles, hamstrings and stuff like that. What do you do for hamstring strain? A torn hamstring muscle, the back of your thigh. Nothing. You don't do anything. We say, "Well, yeah, it looks like you probably tore it." That torn muscle, just like a torn ligament, bleeds and you get a huge bruise. My son-in-law really tore his not too long ago. What do? You're just sore and it's hard to walk for weeks. But guess what they do? Whoop, they all heal. He was playing basketball the other day and doing fine. They all heal and do just fine. It's like Mother Nature made us so that we can tear things and then they heal. So hopefully that will help you and answer some questions. Okay? Thanks for tuning in. We'll see you next time. Bye-bye.